Imagine going into a hospital room having reviewed every word of every note in every record that's ever been written about a patient.
The best thing about a comprehensive electronic health record is that you have all the information at your fingertips. I would also say that information is so comprehensive that it's often overwhelming.
There's no lack of data. It's the fragmentation of the data that is a challenge.
Scout is a general tool that can help alleviate some of the documentation burden that people were having. Towards the end of my PhD was right around the time that ChatGPT came out. There's no reason why, if this technology exists outside of the health system walls, that it shouldn't exist on the inside as well.
This was a problem that had not been solved by anyone else in the industry. And rather than waiting for someone else to create a tool that we could deploy and solve this problem, we just decided to build it ourselves with input from our researchers, our clinicians, our statisticians, our computer scientists.
I would describe it to a friend as a search engine for the electronic health record that allows us to ask a question using natural language and develop a very comprehensive answer in a format that's useful to us.
Time is the most valuable thing. They're not making any more of it, as best I can tell, and we have less and less of it as our patients become more and more complex.
What Duke is doing really well is getting computer scientists, data engineers, clinicians, and putting all of them in the same room so that when building a platform that we can use, it's tailored exactly for what we need it.
Some children have been at Duke since birth, and so there is a lot of history to kind of comb through, and I used to find little pieces here or there, and now with Scout it gives me like a timeline, so I get a much more robust picture.
I had a recent patient in the clinic with a very complex history, and Scout not only extracted the data, but it even extracted data that even the patient did not remember, and that provided us with an additional setting for the decision-making of his specific care.
We put together dossiers for patients who are going to be coming to us for surgical care. That is an incredibly time-consuming task. With Scout, that task can be achieved in just a few minutes.
Scout drastically reduces the amount of time it takes to complete tasks, but more importantly, they retained the accuracy, the completeness, and the relevance of the answers while doing so.
Every single thing that it says is referenceable to the exact location in the chart where they pull out the information.
You know where every sentence comes from, and that's critical.
We did a clinical trial where we compared APPs, fellows, physicians, how they summarized the chart compared to Scout. And we saw it worked just as well, if not better, and it lowered the cognitive burden on the individual trying to summarize the chart.
So every time someone is not sitting in Epic trying to work through a chart, they can be doing something revolutionary. They can be curing a new disease or coming up with a new device or sitting with their patient and talking to them. And Scout gives us the gift of time.
I think AI will actually make doctors get back to what brought them to medicine in the first place. Sitting in a room with a patient, holding a hand, helping people through difficult times, explaining difficult concepts, and that's really what medicine's all about. We're trying to return to that purity in medicine.
I just love it. I'm not going back.